I'm about to introduce you to one of the most multifaceted devices I've ever introduced to my clinic in over a decade. Plexr is an incredible cutting edge and in fact the first aesthetic plasma device that was introduced into the market. So what does it do? Well, people often complain about skin laxity, whether it's around the eyes or perhaps in the middle face, lower face certainly, and definitely on the neck. They might be bothered by heavy eyelids. Even at an early age, particularly women, they complain of makeup smudging on the upper eyelid. And of course, this happens, it can make us look more tired, and especially when we get comments that, oh, are you tired, have you slept well, it can get people down. Really, there's probably very few people who wouldn't be suitable, wouldn't have some issue that could be addressed with Plexr. And of course, I'm only touching the surface of what you can use Plexr for. It's also a surgical device. It can remove very nicely and safely with minimal healing time, skin tags, various kinds of moles that obviously have been checked out first to make sure that there's nothing sinister. And it's a really lovely way of even removing more difficult lesions like xanthelasma, which is these cholesterol lumps that people can get around the eye area, which actually normally need surgery to remove. And again, I'm only touching the surface. So let's get into the device and let me talk about how it actually works. What's amazing is that this device will never actually touch your skin to do the treatment. That's right, it won't touch your skin. So plasma energy, that's not like plasma in blood. It's plasma is actually created in the atmosphere. If you've seen the Northern Lights, or you've seen a lightning arc hit the ground, that's actually plasma being created in the atmosphere. And I often give the analogy of this being like the hand of God, and a lightning arc is the little tiny arc that I'm creating when I engage the device. And just like a lightning arc or bolt will hit the ground and create a little scorched area, likewise with this, you're going to create a tiny pin-sized area of carbon crust where you've removed just the surface of the skin. The true chemical name is actually called sublimation. So people often say you vaporize the skin. What we're doing is sublimating skin, which means we're turning solid skin into a gaseous state without going through the liquid phase. It's like turning ice into steam without it becoming water first. And we're doing this in a split second. Now the beauty is that it's only doing that on the very surface of the skin. We're not causing a deep injury here. And this has been backed up by studies that have actually taken microscopic samples of the skin tissue and looked at it under a microscope and shown how deep it works. And what we're doing is creating this micro injury across the skin surface. That carbon crust is going to fall off about a week later, leaving tiny dots that are slight dips in the skin. And then as they refill and reform, that new skin that's coming in is going to be made up of new, youthful collagen fibers that are nicely tightly packed together like you had in your teens and your early 20s. And so what we're doing really with Plexr is it's not, I think once incorrectly, I likened it to a non-surgical scalpel alternative, but actually it's not like surgery, because surgery is cutting away redundant skin, say on the upper lids, but what you are left with is the same aged, damaged skin. And that's how you're getting tightening, by removal. With this, you're actually getting skin tightening through regeneration, through actually reversing time-related damage. You're replacing age damaged skin with youthful skin. And that's the beauty of it. That's really how we now want to be doing things. So yeah, you may not get a surgical result from one treatment, but certainly if we perhaps do a second one, sometimes rarely a third one, you can actually get results in some patients that are pretty close to actually what surgery could have delivered, but without any cutting or any stitching, and of course without bruising as well. So there are benefits to it. So typically we're using this mostly for upper lid tightening, lower lid tightening. The nice thing is surgery can't really help with the crow's feet area, but of course with this we can get amazing results, which we'll show you on the crow's feet area as well. And so people really don't like these thick folds and the deep lines that have been created. And even with one session, you can get quite amazing, impressive results that surpass what I get with some of my resurfacing lasers or other modalities for skin tightening. So for focal areas that are really bothering people, where they really want a good outcome, even after one, certainly two sessions, this I think is the absolute winner amongst every type of device that I've got. For face, you can of course do little mini facelifts or larger facelifts where there's a lot of laxity, even sometimes where you've got folds that are just there. This is really good at flattening those folds down. Whereas if we're doing other sessions, you have to do quite a lot to get even 20% improvement. So this is brilliant. But one of my real favorites with this, and in fact, I won't mention him by name, but one of the best known doctors worldwide who actually made his name originally in laser resurfacing and is now one of the best known injectors. He actually sent me a message after I trained his team on this, and we treated a model patient around the mouth for deep lines and resurfacing around the mouth. And he said to me just 4 weeks later when he was reviewing the lady, he sent me a voice note and said, "This is the best outcome I've seen from a single treatment of any machine on this area for this problem." And that's what I love this for. Most of the patients will just have one session. You do have like a thick crust around this area for up to a week, as I say, so there is that downtime to consider, but the outcomes are incredible. They're absolutely incredible. And overall, the safety profile of this is brilliant in the right hands. I emphasize that. There are a lot of copycat devices out there. We've even heard of devices that have actually been branded with Plexr but actually aren't Plexr inside. And it is very technique and operator dependent. And I'm not saying that lightly. You know, it really is something that unless you've got the experience and the know-how of knowing how much to do on a given area in a given patient, then of course harm can be caused, as with any of the devices and treatments we've got here. So we've performed over 2,500 Plexr treatments at Perfect Skin Solutions. I first introduced it to the UK. In fact, it was the first clinic to have Plexr, and we have been using it since 2014. And what is really amazing is that we're seeing people experience the longevity. So how long do the results last for? Well, I would say 5+ years in most patients. Just yesterday, I had someone turn up who saw me for a single session of Plexr on the upper eyelids in 2019, and in 2025, she's coming back, and we can still see really good improvements in the upper lids. Yes, some of the effect has gone, but that's 6 years on. And in fact, she's now coming seeking tightening in the under eye area and asked for maybe just a touch up on one of the upper eyelids, but with the other one, she's absolutely happy still that many years on. And I think most people don't expect a non-surgical option to give that longevity, and you get it. It's not that if you want something to last long, you have to go for the surgical option. Of course, surgery for some people is going to be more appropriate, and we do offer upper lid blepharoplasty at the clinic, and so we do, if appropriate, refer people to the surgeon if they indeed want to explore that option. So just to recap with Plexr, we've got a plasma device. It's generating plasma energy to hit the skin and create this sublimating effect, which means we're taking away tiny dots to the surface of the skin. When those crusts fall off, it's replaced by new, youthful, collagen-rich skin, which is going to give that nice, tighter, firmer, plumper skin. And of course, the surface is going to be smoother. So if it's got lots of lines and wrinkles, this is really good as a resurfacing tool. I opt for laser if I need to do the entire face and neck, but if I've got really severe issues, advanced damage, aging present, then Plexr is going to win on those focal areas, particularly around the mouth, the deep lines and wrinkles, or the laxity, definitely upper lower eyelids and crow's feet area, and also just doing a little bit of a nice facelift on this area if you want this just to be tightened up. The neck also responds beautifully to it. Remember, it's not going to work on fat, it's just going to work on skin tightening, but again, really powerful for that. And of course, all the different skin lumps, lesions as we call them. So whether it's the fatty lumps that you get from, potentially having high cholesterol levels, or it's little even styes, skin tags, and of course, various moles like seborrhoeic keratoses, which are very, very common in the UK population, particularly in those over 40. And again, all of these benign lesions are not going to be dealt with on the NHS and typically need a more surgical approach. But with Plexr, we're avoiding essentially having an often bloodless procedure with just a little drop of anaesthetic for that, and then you're good to go. I should have mentioned that for the aesthetic side of things, with the skin tightening and resurfacing, we use numbing cream. It's a really good numbing cream for about 40 minutes, and then most people are good to go with the treatment, reporting mild to moderate discomfort during the treatment, but manage it absolutely fine. If, of course, someone is a bit more sensitive, we can inject some anaesthetic to ensure that your experience is as pleasant as possible. In terms of aftercare, you're going to use the Selderma GF5 Growth Factor Home Treatment Program. It's a simple pump used like a serum that accelerates healing, and it actually improves the final outcome for you as well. And then just one other product, which is a colour-matched medical foundation that we give you to cover up that residual redness that will follow for some weeks after the crust has fallen off. So it's really, whilst the crust is there, you're going to have some social downtime. Once the crust is off, you can cover up the redness and go out without anyone noticing anything is going on underneath. But the true healing can take some time before it's complete, but that comes with amazing outcomes. Thank you very much, and do visit our website and plexrplus.com if you want to learn more. Thank you.